Small daily habits often have a greater impact on long-term wellness than many people realize. Sometimes the body simply responds to more consistency, better recovery, and healthier routines over time. Paying attention to sleep, movement, nutrition, and overall balance may help support healthier aging in ways that feel manageable and realistic. I'm Dr. Hina Kim, and continuing to learn about your health is always a valuable step forward. Good afternoon, I'm Dr. Hina Kim, men's health and wellness specialist. Today, I want to talk about something many men begin to notice in their 50s and 60s, lower daily energy levels. A lot of men describe it as feeling more tired in the afternoon, needing longer recovery after activity, or simply not feeling as sharp and active as they used to. In many cases, this change is connected to normal aging, lifestyle habits, sleep quality, nutrition, stress levels, and reduced physical activity over time. Low energy does not always mean there is a serious medical problem, but it is something worth paying attention to because the body often gives small signals before larger health concerns develop. One important area to understand is sleep. As men age, sleep patterns can change naturally. Some men wake up more during the night, sleep fewer deep hours, or feel less rested in the morning even after spending enough time in bed. Poor sleep quality may affect concentration, mood, stamina, and overall daily motivation. Simple habits such as limiting heavy meals late at night, reducing screen time before bed, and maintaining a consistent sleep schedule may support better rest over time. Another factor is physical activity. Many men become less active with age because of work routines, joint stiffness, or busy schedules. But the body responds strongly to movement. Regular walking, light strength training, stretching, and moderate exercise may help support circulation, muscle function, and overall energy throughout the day. Even small amounts of daily movement can make a difference when done consistently. Nutrition also plays a major role. Some men skip meals, rely heavily on processed foods, or consume too much sugar and fast food without realizing how much it affects energy levels later in the day. The body needs balanced nutrition to maintain steady energy. Meals that include lean protein, vegetables, fiber, healthy fats, and proper hydration may help support more stable daily performance. Hydration is especially important because mild dehydration alone can contribute to fatigue and low focus. Stress is another commonly overlooked issue. Long-term stress may affect sleep, eating habits, physical activity, and mental focus. Many men carry stress quietly for years without noticing how strongly it affects the body physically. Taking short breaks during the day, spending time outdoors, staying socially connected, and creating healthier daily routines may support both mental and physical wellness. It is also important to remember that certain medical conditions can sometimes contribute to low energy. Issues related to blood pressure, blood sugar, heart health, hormone changes, or nutritional deficiencies may affect how the body feels day to day. That is why regular health checkups become increasingly important after age 50. Preventive care and routine monitoring can help men better understand what is happening inside the body before symptoms become more noticeable. Another thing I often remind men is that energy is not only about age. Daily habits accumulated over many years have a strong impact on how the body functions later in life. Small consistent improvements in sleep, movement, nutrition, hydration, and stress management often support better overall wellness more effectively than extreme short-term changes. Many men expect to feel exactly the same as they did in their 20s or 30s, but healthy aging is usually about maintaining strength, mobility, mental clarity, and independence in a realistic and sustainable way. The goal is not perfection. The goal is supporting the body so it can continue functioning well through the years ahead. I also encourage men to pay attention to gradual changes rather than ignoring them. Persistent fatigue, major sleep problems, loss of motivation, or sudden declines in physical stamina should always be discussed with a qualified healthcare professional for proper evaluation. Your body often responds positively to steady routines, balanced habits, and long-term consistency. And sometimes the smallest daily choices can have a meaningful impact on overall energy and wellness over time. Another important area that deserves attention is muscle health. After the age of 50, the body naturally begins to lose muscle mass gradually over time, especially when physical activity becomes limited. This change may affect balance, posture, endurance, and daily energy levels. Simple resistance exercises, bodyweight movements, and regular mobility work may help support muscle function and physical stability as men age. Consistency is usually more beneficial than intensity. I also encourage men to pay attention to eating patterns throughout the day. Some men rely heavily on caffeine to push through fatigue, but excessive caffeine combined with poor sleep and irregular meals may sometimes create a cycle of temporary energy followed by stronger fatigue later. Balanced meals eaten at regular times may help support steadier energy throughout the day. Protein intake is particularly important for maintaining muscle health and supporting recovery after physical activity. Sunlight exposure and outdoor activity may also influence overall wellness. Spending time outdoors during daylight hours may support healthy sleep rhythms, mood, and physical activity habits. Even short daily walks outside can contribute to both mental and physical well-being. Another common issue is prolonged sitting. Many men spend long periods sitting at work, driving, or watching television without much movement during the day. Long sitting periods may affect circulation, joint flexibility, and overall physical conditioning. Standing up regularly, stretching, and adding short movement breaks throughout the day may help support better daily comfort and energy. Digestive health can also influence how the body feels. Heavy meals, excessive alcohol intake, or highly processed foods may sometimes leave men feeling sluggish or uncomfortable. Paying attention to portion sizes, hydration, and balanced food choices may support digestion and overall wellness. Mental wellness is equally important. Aging can bring changes in responsibilities, routines, retirement planning, and social connections. Mental fatigue and physical fatigue often influence each other. Maintaining hobbies, staying socially active, continuing meaningful routines, and keeping the mind engaged may support overall quality of life as men grow older. It is also helpful to approach health changes gradually rather than trying to change everything at once. Small realistic adjustments are often easier to maintain long-term. For example, improving sleep habits, adding daily walks, increasing water intake, or preparing more balanced meals can become sustainable routines over time. Preventive health discussions with healthcare providers are another valuable part of healthy aging. Routine screenings, medication reviews, and regular wellness visits may help identify areas that deserve attention before they begin interfering with daily life. Many men delay checkups because they feel generally fine, but preventive care plays an important role in long-term wellness and maintaining independence with age. Healthy aging is usually supported by a combination of physical activity, nutrition, recovery, stress management, and regular medical guidance. The body changes over time, but supportive daily habits may help men remain active, engaged, and physically capable well into later adulthood. And very often, improving energy levels starts not with dramatic changes, but with paying closer attention to the body's everyday patterns, routines, and overall lifestyle balance. Another area many men overlook is recovery time. As the body ages, recovery after physical activity, travel, poor sleep, or stress may take longer than it did earlier in life. That does not necessarily mean the body is weak. It often means the body benefits more from structured routines, adequate rest, and balanced activity levels. Allowing time for recovery between demanding activities may support overall physical function and reduce unnecessary fatigue. Joint health also becomes increasingly important with age. Stiffness in the knees, hips, lower back, or shoulders may reduce overall movement during the day, which can gradually affect energy levels and mobility. Gentle stretching, flexibility exercises, walking, and maintaining a healthy body weight may help support joint comfort and daily movement. Many men avoid activity because of stiffness, but reduced movement can sometimes contribute to even greater discomfort over time. Breathing habits are another factor connected to overall wellness. Shallow breathing during stress or long periods of sitting may affect relaxation and physical comfort. Simple practices such as slow breathing exercises, posture awareness, and regular movement breaks may help support relaxation and daily focus. It is also useful to pay attention to meal timing late in the evening. Heavy meals close to bedtime may sometimes interfere with sleep quality and overnight recovery. Lighter evening meals combined with consistent hydration habits may support more comfortable sleep patterns for some individuals. Alcohol consumption is another area worth discussing honestly. Some men use alcohol regularly to relax after work or during social situations without realizing that excessive intake may influence sleep quality, hydration, energy levels, and recovery. Moderation and awareness of overall lifestyle balance remain important parts of long-term wellness. Daily routines often become more important with age. The body tends to respond well to regular sleep schedules, planned meals, physical activity, and consistent wake times. Irregular habits may sometimes increase feelings of fatigue or reduce overall physical efficiency during the day. Brain health and focus should also be considered part of overall energy. Mental sharpness can be influenced by sleep, physical activity, hydration, stress levels, and social engagement. Activities that keep the mind active, including reading, learning new skills, conversations, and mentally engaging hobbies, may support cognitive wellness as men age. It is also important for men to avoid comparing themselves constantly to others. Aging affects every individual differently depending on genetics, lifestyle habits, work history, stress exposure, and overall health. The goal should be maintaining personal wellness and functionality rather than trying to meet unrealistic expectations. One healthy approach is to observe trends instead of isolated days. Everyone experiences occasional tiredness. But when low energy becomes persistent over weeks or months, it may be helpful to review daily routines, sleep habits, stress levels, physical activity, and overall nutrition patterns more carefully. In many cases, supportive lifestyle habits work together rather than independently. Better sleep may improve motivation for exercise. Regular exercise may support mood and sleep quality. Balanced nutrition may help support physical recovery and mental focus. Over time, these connected habits can contribute to a stronger foundation for healthy aging and overall daily well-being. Another useful habit is monitoring how the body responds to daily routines over time. Some men notice they feel better with more morning activity, while others benefit from lighter evening meals or earlier sleep schedules. Paying attention to these patterns may help create routines that support more stable energy throughout the week. Appetite and metabolism can also change gradually with age. Some men become less active but continue eating in the same way they did decades earlier, while others unintentionally eat too little during busy days. Both situations may affect overall energy and physical performance. Balanced eating habits combined with regular movement often support healthier long-term wellness. Maintaining healthy body composition is another important factor. Excess body weight may place additional stress on joints, sleep quality, circulation, and physical stamina. At the same time, unintentional weight loss or muscle loss should also be discussed with a healthcare professional, especially if it occurs alongside ongoing fatigue or weakness. Heart health is closely connected to daily energy as well. The cardiovascular system supports oxygen delivery throughout the body during movement and activity. Regular physical activity, balanced nutrition, stress management, and avoiding tobacco products may help support long-term cardiovascular wellness. Many men also underestimate the importance of routine hydration during colder months or while staying indoors. Thirst signals may become less noticeable with age, yet the body still depends on proper fluid intake for circulation, focus, digestion, and physical performance. Keeping water intake consistent throughout the day may support overall body function. Posture and body mechanics can influence energy levels more than many people realize. Poor posture during sitting or standing may contribute to muscle tension, discomfort, and feelings of physical fatigue. Simple adjustments such as standing more frequently, stretching the neck and shoulders, and maintaining ergonomic workspaces may support physical comfort over time. It is also helpful for men to approach wellness with patience. The body generally responds best to sustainable habits practiced consistently rather than extreme routines followed briefly. Small daily actions often become more meaningful over months and years than sudden short-term efforts. Social wellness deserves attention too. Isolation, reduced social interaction, and lack of engagement can sometimes affect motivation and emotional well-being. Maintaining friendships, family communication, community involvement, or group activities may support healthier aging both mentally and physically. Many men focus only on productivity and responsibilities while ignoring recovery, relaxation, and personal wellness. but long-term health often depends on balance. Physical activity, rest, nutrition, social connection, and preventive care all work together to support overall quality of life. It is also completely normal for energy levels to vary slightly from day to day. Sleep quality, stress, activity level, hydration, and nutrition can all influence how the body feels on any given morning or afternoon. The more important goal is recognizing long-term patterns and supporting the body with stable, realistic wellness habits that can be maintained consistently over time. As we get older, the body naturally changes, but healthy aging is often supported by consistent daily habits and regular attention to overall wellness. Good sleep, balanced nutrition, physical activity, hydration, stress management, and preventive healthcare all play important roles in maintaining energy and quality of life over time. Even small lifestyle improvements practiced consistently may help support better daily function and overall well-being. I'm Dr. Hina Kim, and I encourage you to continue listening to your body, staying informed, and making gradual choices that support long-term health as you age.